Hi, I'm Dr. Shiji Chalipat, consultant pediatric neurologist at Ankura Hospital, Pune. Today, I'm briefly going to talk about a common condition which I see in my OPD, which is headache in children. As you know, headache is very common in adults. Surprisingly, it is very common in children as well. You might have heard about migraine as well as tension headache and as well as brain tumors causing headache. I know these all are worrisome for you, but let me reassure you, most of the headache in children are not because of serious problems. So let me take you through the causes of headache. So first we'll see migraine. Migraine in children. So migraine in children is like adults with few differences. So it happens commonly in teenage age group, but can be seen after 7 to 8 years of age. The type of pain is actually very severe. It can be on one side of head or both side of head. It can be associated with feeling of vomiting, which is called as nausea. Sometimes they end up in vomiting. They can have the symptom of avoiding the light, avoiding the loud noise, and prefer to sleep in a dark room with sounds everything off. And good sleep will make them feel better. Another type of headache is tension type headache, in which a stress factor will activate or precipitate their headache. And the type of headache here is mainly like a band of pain around their forehead, and it is dull in quality and severity compared to migraine, it is less, it is mild to moderate. But there are many triggers for these two types of headache. As I said, the name indicates tension type headache triggered by stress, tension. But migraine, other than stress, there are many factors which might precipitate these headaches. So let's see what are the triggers which causes or precipitate these headaches in children. The common triggers are skipping of meals, which is very commonly seen in our teenagers. They don't sleep on time, they have a lot of screen time, eat a lot of junk food, eat a lot of Chinese food, chocolates, caffeinated drinks, and screen time is a main reason for all these things in effect. So, identifying these triggers are very important because that is a mainstay of treatment by avoiding these triggers. The migraine headache and tension type headache are classified under primary headaches. What is this primary headache? These are the headaches in which there is no definite cause as underlying. So that these type of headache doesn't need any evaluation like brain scan or other blood investigations. We need to just manage the triggers and treat the headache and prevent the recurrences. That is a mainstay. What are the other group of headache? So these are the primary, so there is a secondary. So the secondary headache are more worrisome. This is due to a definite underlying cause. So what are the common causes of this secondary headache? So the common causes for secondary headache, which is less serious, are cold, sinusitis, a simple viral fever, or even a dental infection can lead to headache. But there are serious causes which are concerning for the secondary headache, which are the main concern for a doctor as well as a parent. So they are the brain tumors, increase in the pressure in the brain, or some bleed into the brain. So these are the conditions in which we need to act immediately. So how will you understand the secondary headache symptomatology? So they are the warning signs which gives us the hint towards this can be secondary headache. So these warning signs are named as red flags. So let's see what are these red flags. So if the headache is mainly in the morning and child is getting up from sleep with severe headache and vomits, so that is one red flag. Second, if the headache is very severe and progressively increasing without any gaps in between. Third, if headache is associated with any other neurological symptoms like visual symptoms like double vision, if the child has frequent falls and loss of balance, if child has change in speech or change in behavior, all these indicates there is something serious happening in the brain. Other than this, other red flags are any child less than 5 years. If that child is having acute onset of headache, that is very important to get evaluated. So these are the red flags in which condition you should understand, immediately consult your pediatrician or pediatric neurologist. So these conditions needs evaluation with blood investigations and as well as brain scans. So that's a main investigation required. Now let's see what are the treatment plan. So in the treatment, the main part of treatment of migraine or tension type headache is keeping a headache diary. So headache diary means either it can be kept by the parent or by the child. So if she is a teenager, they can keep a diary. So in diary, they need to write down the headache frequency, duration, severity, what are the triggering factors. So every time after eating something or after missing something, that trigger is causing that headache, so that these triggers can be avoided. Another advantage of having a headache diary is after treatment, how frequency of this headache are decreasing, duration decreasing, severity decreasing. So to see the treatment response, we can use this headache diary. So after identifying these triggers, we need to counsel parent as well as the child to have a good appropriate sleep of 8 to 9 hours, avoiding the screen time or decrease the screen time, have meals on time, and what you eat. So avoid junk food. That is very important. Excessive chocolates should be avoided and caffeinated drinks should be avoided. So depending on the triggers, we can decide on this. Second, the treatment of the pain. So simple paracetamol is enough to treat the pain. But if it is not responding to that, then higher level pain medicines can be given, but only after consulting with the doctor. Excessive use of painkillers is not good for the child and it itself will lead to pain, headache. If after avoidance of triggers, after these medications also still child getting frequent headache, affecting his schooling, affecting his activity, we should always start on daily medications, which is known as prophylactic medications. And that is usually done after ruling out all the reasons, confirming the diagnosis, then only we start on these medications. For that, you have to definitely consult. Only after that, we need to start this treatment. So to conclude, headache in children, even though distressing for the parents and children, it is treatable if we evaluate and manage on time. So avoidance of triggers. That is the main thing needed. And if you have any concerns, please do consult us on the following number. We are always there to help you. Thank you.